Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I will begin today's update with a review of our recent positive cases. The number of positive COVID-19 tests in Dare County is 215, 58 of which are considered active. Of the 215 cases, 124 are residents and 91 are non-residents. The majority of cases continue to experience mild to moderate symptoms. However, there are cases which have experienced severe illness. Currently, one resident remains hospitalized in critical condition. Since the last Dare County Department of Health and Human Services update, issued Friday, July 10, 2020, there have been 35 new positive cases. Of these 35 cases, 23 are residents and 12 are non-residents. The Dare County website has already been updated to reflect all of these cases. Of the 23 resident cases, one of the cases is symptomatic, who acquired the virus by direct contact with individuals whose positive test results were reported on 7/11. 3 of the cases are siblings, all symptomatic, who acquired the virus by direct contact with a family member whose positive test result was reported on 7/7. One of the cases is symptomatic, who acquired the virus by direct contact with a family member whose positive result was reported on 7/3. 6 of the cases, 4 asymptomatic and 2 symptomatic, are close contacts who acquired the virus by direct contact with an individual whose positive test result was reported on 7/11. 2 of the cases are coworkers, both symptomatic, who acquired the virus by direct contact with an individual whose positive test result was reported last week outside of Dare County. One case is symptomatic and acquired the virus by direct contact with an individual whose positive result was reported last week outside of Dare County. This case is not related to the one previously mentioned. 2 of the cases are asymptomatic family members. It is unclear how these individuals acquired the virus, which indicates community spread. 7 of the cases are not connected, 3 symptomatic and 4 asymptomatic. It is unclear how these individuals acquired the virus, which indicates community spread. Of the 12 non-resident cases, 2 of the cases are symptomatic and acquired the virus by direct contact with a resident whose positive test result was reported on 7/7. 2 of the cases are household contacts, both symptomatic, who acquired the virus by direct contact with individuals whose positive test results were reported on 7/3. 2 cases are family members, both symptomatic, who acquired the virus by direct contact. 6 of the cases are not connected, 4 symptomatic and 2 asymptomatic. 3 acquired the virus by direct contact with positive individuals outside of Dare County, and the other 3 most likely acquired the virus by community spread outside of Dare County. Contact tracing has been completed on 33 cases, and direct contacts provided by these individuals have been identified, notified, and directed to quarantine for 14 days from the last date of exposure with the positive case. Unfortunately, we are still working with 2 of the individuals in attempts to get them to cooperate with contact tracing. We continue to see growing cases of COVID-19 in Dare County. The majority of cases are occurring because of direct contact. We are seeing friends spreading the virus to friends and then spreading it further to family members and close coworkers. I cannot stress enough how important it is to maintain physical distancing from others, at least 6 feet, and limiting direct contact with others outside of your household. The 3 W's are proven tools to help slow the spread of COVID-19. Since we do not have medications or vaccines, it is critically important that we all follow the 3 W's: wear, wait, and wash. Wear a cloth face covering if you'll be with other people. Wait 6 feet apart and avoid close contact. And wash your hands often with soap and water for at least 20 seconds, or use hand sanitizer. In addition to following the 3 W's, all individuals are reminded not to go out if you are sick, or if you are experiencing any symptoms of illness. Do not go to work, do not go to the grocery store, or visit with friends. If you are feeling sick, contact your healthcare provider, but otherwise call on friends or family members to drop off needed supplies. Some of our recent positive cases occurred when individuals who had very mild symptoms had direct contact with friends. Unfortunately, they exposed their friends to the virus before they realized their symptoms were actually related to their COVID-19 infection. On July 9, 2020, Dare County DHHS partnered with Mako Medical Laboratories to host an antibody and diagnostic testing event for COVID-19. 222 diagnostic tests were conducted, with 7 positive results, 0 inconclusive, 0 invalid, and 215 negative results. 127 antibody tests were conducted, with 2 positive results and 125 negative results. Today we are partnering with Mako Medical Laboratories to host a community testing event starting at 1 p.m. at Dare County Parks and Recreation Center in Kill Devil Hills. Results from this clinic are expected to be available beginning Friday, July 24th. Dare County DHHS monitors and evaluates 4 key metrics associated with disease investigation and surveillance. The metrics are number of tests, confirmed cases, positive test as a percent of total test, and COVID-like illness surveillance. This past week, there were 970 COVID-19 diagnostic tests performed in Dare County. 748 were performed by local healthcare providers, and 222 were performed at the community testing clinic on July 9th. This brings the total number of tests performed in Dare County since early March to 4,547. We had 70 positive cases between July 6th and July 12th. The percent of positive tests to overall tests in Dare County since we started testing in early March increased again this week to 4.53%. The percent positive to total tests for the past week alone was 7.2%. The syndromic surveillance of individuals who presented to the emergency department did not show patients presenting with COVID-like symptoms this past week. However, the local urgent care center saw a high number of patients presenting with COVID-like symptoms. These graphs can be found on the Dare County website at darenc.com/COVID-19. We encourage you to stay informed by visiting darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.